Good afternoon. Today is Tuesday, October 6th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. COVID-19 is still being transmitted in our community. Other than reported clusters, such as in the SUNY Oswego community, over the past few weeks, we are still seeing sporadic cases in our towns and in the two cities. We ask you to please continue to wear a mask, to social distance, and to follow the CDC and New York State guidelines for preventing the spread of coronavirus. We know that people are choosing to visit Oswego County for the salmon run this fall, regardless of COVID. The health and safety of our residents and visitors remain our priority. We want people to have a good experience while they're here, but we also want to make sure they're doing what we can to prevent the spread of the virus. We've recently installed billboards at locations around Oswego County and on Interstate 81, reminding visitors that they need to practice social distancing. The billboards are just one piece of our outreach program. Educational efforts have been advanced by the New York State DEC, the Village of Pulaski, and the County Health Department. The County Tourism Team and the DEC also placed signage at several popular fishing spots and local businesses reminding anglers to socially distance, wear your masks, and practice other health and ethical angling guidelines. DEC officers are engaging visiting anglers and reinforcing the need to follow safe practices. We expected to receive complaints about the number of anglers and difficulty social distancing. Our partners in the DEC, the County Sheriff, and other area law enforcement and the County Health Department are working together to encourage people to fish safely and to help stop the spread of the virus. At SUNY Oswego, the college resumed in-person classes yesterday with the approval of the County Health Department. The college still maintains several other related restrictions to help curb the spread of the virus. Students and employees continue to be tested on a regular basis, and we appreciate the leadership of President Stanley for cooperation and protective measures. And now, Senior Public Health Educator Diane Oldenburg will report on this week's test results.
Thank you. Besides working closely with SUNY Oswego, our department continues to consult with local school districts on a daily basis. When a staff member or student tests positive for COVID-19, we implement contact tracing to determine who might be impacted by the possible exposure. We follow the State Department of Health protocols on this. Investigations go back 2 days prior to symptom onset for symptomatic positive patients or 2 days prior to testing for asymptomatic positive patients up until the time a positive patient is isolated. In the event that a person who is tested positive for COVID-19 had public exposure when they were contagious and we couldn't contact those at risk individually, we would issue a news release. It is extremely important that parents keep their children home if they aren't feeling well, and that everyone stays home if they are sick. This will be even more important when flu season arrives later this fall. Flu vaccine is recommended for anyone 6 months of age or older. We suggest you arrange to get a flu shot through your primary care provider, community health agency, or at a health department clinic. Flu shots are available from the County Health Department on Mondays, Wednesdays, and Fridays by appointment only. Please call 315-349-3547 to schedule a time. The 7-day rolling average for people testing positive for COVID in Oswego County is 1%. As of today, we've conducted 51,366 tests on county residents. We've had 669 positive test results come back. We have 37 active cases. We've released 629 patients from isolation. We have 4 deaths related to COVID, and we have 50,567 negative test results returned. Currently, there are 220 residents in mandatory isolation or quarantine. Antibody test results out of 3,477 tests administered, our latest report shows 84 positive antibody tests. Our rate of infection with the antibody testing continues to be 2.4%. We continue to staff our COVID-19 hotline on weekdays. Anyone with questions can call the hotline at 315-349-3330, Monday through Friday between 8:30 a.m. and 4 p.m.
Thank you, Diane. Despite all the negativity and anxiety around the COVID pandemic, there are still good people doing good things in our community. Every year, our Emergency Medical Services Advisory Council honors healthcare workers and first responders for their life-saving efforts. This year's recognition banquet had to be canceled, but the council has announced the 2020 award recipients. They are David Sandbrook, Advanced Life Support Provider of the Year; Stephen Hauk, Basic Life Support Provider of the Year; Nathan Smith, Emergency Medical Services Leadership Award; Jeff Andrews, Emergency Medical Service Educator of Excellence; James Mangano, Physician of Excellence; Aaron Spillman Kinney, Registered Nurse of Excellence; and the Constantia Volunteer Fire Department, along with the Mexico Volunteer Fire Department, are the fire department's first responders of the year. I want to thank all of our first responders who answered their pagers and continue the important work of caring for our families, friends, and neighbors day in and day out. Thank you for doing your part in helping to prevent the spread of COVID-19, and be safe and be well. You are making a difference.